Our next speaker is Dr. Jonathan Wright, who is a urologist, a surgeon in the Department of Urology at the University of Washington, and also has an appointment here at Fred Hutchinson's. In addition to actually surgically treating men with prostate cancer, he has a very active research interest in understanding issues related to prevention and certainly preventing progression. So he's going to talk a bit about exercise in that role. Jonathan?
Thank you, Pete, and good morning, everyone. So we've heard a bit about the evolution of screening, the evolution of radiation therapy. You're going to hear later about the evolution of our treatments, and I get to deal with this evolution. Obesity has certainly become an epidemic in our country, and it's becoming an epidemic worldwide as well. And the question is, what does that have to do with prostate cancer? Well, it has a lot to do with prostate cancer. We know, and this is pooled data from upwards of 1 million patients from different studies, that obesity is associated with prostate cancer mortality. So BMI is your body mass index. It's a ratio of your weight and your height. Normal weight is a BMI less than 25. Overweight is 25 to 30. Obese is greater than 30. And so on, very obese above 35. These pooled data show that among men with prostate cancer, for every 5-point increase, so going from normal weight to overweight, 20% increased risk in prostate cancer-specific mortality. You go from overweight to obese, another 20% increase in prostate cancer-specific mortality. Certainly, obesity leads to non-prostate cancer death, cardiovascular disease, etc., but it also is driving the cancer. And just to highlight this, we contributed to some of this huge work. Dr. Stanford here was one of the authors on this, on a paper looking at our own experience with obesity and prostate cancer progression. We even know, not just looking at mortality, but also we heard earlier about the importance of active surveillance and reserving treatment for those patients who are most likely to have adverse pathology. This is a study where they took men with low-risk disease on active surveillance. They all had a second confirmatory biopsy, trying to get rid of the idea that the first one just sampled poorly. And then they followed them for several years. And these patients, for those men who are on active surveillance, know you undergo sequential biopsies. And what this bottom line shows here, the green line, this is looking at men that were obese on active surveillance. And they were more likely, over time, to have more aggressive prostate cancer found on surveillance. This is a complex picture, but what it's looking at, if we go from the active surveillance now to the active treatment, men who have prostate cancer undergo prostatectomy. Those who gain weight after prostatectomy, that's this line. Weight change, percentage, that's the hazard ratio, the risk of recurrence goes up. Even after prostatectomy, gaining weight, increased risk of prostate cancer recurrence. This curve going down below 1 is those patients that were losing weight after surgery, going from obese to overweight down to normal weight. You can impact the disease progression or action by being active in your own life. The problem is it's not easy to lose weight, as all of us, myself included, know. This is from another local effort. This is data from the past prostate active surveillance study, the Canary protocol, the Canary supported study. This is about to be published. And there's a lot going on here, but the thing to focus on is these big green bars in here. These are the percentage of people at 6 months and 12 months, normal weight, overweight, and obese, on active surveillance, who basically stayed the exact same weight. Not many people are gaining or losing weight. And certainly we're seeing these patients and we're telling them, hey, improve your activity, improve your diet. But we don't do a very good job of impacting it. I think people need more direction. I know we all do. And this may be part of the problem. We tell them, go exercise. It's a great picture. So the American Cancer Society has clear recommendations for us about what we should do. Be more active, and they give us guidelines. Aim to exercise at least 150 minutes per week. That's a half hour 5 times a week, 22 minutes every day of the week. Include a little strength activity in there too, strength building. Once we get past 40, we start losing some of our muscle mass. Certainly patients that are on androgen deprivation therapy impacts our bone strength, impacts our muscle mass. We lose it as well. Even more important in those groups to add on some activity as well. And we want to get to moderate levels of activity for the 150 minutes per week. And I'm going to go through some different data that have shown just how exercise, because as we said, we don't have a lot on diet today because Dr. Neuhauser's not here, and I'm focusing on the exercise, but showing how exercise can have a significant impact in our prostate cancer. These are 2 large studies, 50,000 men, 75,000 men. These men actually didn't have prostate cancer when they enrolled. But those that were getting up to a moderate level of activity per week had a 70% reduction in developing advanced prostate cancer, a 30% risk of developing aggressive prostate cancer. So getting up to a moderate and vigorous activity can decrease the risk of prostate cancer development. But we are also starting to see that exercise in those with prostate cancer can reduce the risk of progression. 1,500 men localized cancer, just walking more than 3 hours a week. Okay, that's 180 minutes. That's pretty close to the 150 at a brisk pace, more than 3 miles per hour. Significant reduction in the risk, 57% lower risk of disease progression compared to those who walk at an easy pace for less than 3 hours a week. We aren't talking about doing wind sprints and getting out there and running marathons. You don't have to do that. Another study, almost 3,000 men, same thing. Walking at a brisk pace, more than 3 miles an hour, associated with lower all-cause mortality, not surprising, but also lower risk of prostate cancer mortality. And if you can get up to even vigorous, we're talking about a 61% lower risk in prostate cancer-specific death. It was just presented at the American Association for Cancer Research last week. More data, another study showing the same thing. Increase moderate exercise, lower risk of cancer progression and death. And there are other benefits to exercise in prostate cancer. This is not that important. This is basically meta-analyses, okay, where they pool a bunch of studies together to see what the effect is when they bring all these studies together. These are all studies brought together of men with prostate cancer. They all show improvement, cancer fatigue, overall improvement in quality of life, sexual function, upper body strength, lower body strength, aerobic fitness. So not only are we improving the disease, hopefully, but we're also improving quality of life. And that's obviously exceedingly important when we're talking about quality and quantity of life with prostate cancer and other cancers as well. So what is moderate activity? People ask this all the time. And I actually took this from the U.S. Department of Health and Human Services online. The CDC put this out. They define light exercise, moderate exercise, and vigorous exercise. You can read all these. Brisk walking, 3 to 4.5, 5 miles an hour. Vigorous is walking or running more than 5 miles an hour. Yoga counts, calisthenics. Play doubles, you get moderate activity for tennis, singles. For vigorous activity. I think for the parents and the grandparents in the room, walking while pushing a child in a stroller is moderate. And I really like this, and I took this verbatim. Handling uncooperative young children counts as moderate exercise. So keep that in mind. So chasing, dressing, lifting into car seats. So help out your kids with your grandkids, and you'll actually improve yourself too. So it won't help your sanity, but it will help your prostate cancer. So how does obesity drive prostate cancer? Well, we know obesity does a ton of different things. Actually, so you can look at this. There's hormonal changes. We know about the roles of hormones in prostate cancer. Obesity leads to a state of chronic inflammation, and chronic inflammation also drives cancer. IL-6 goes up, C-reactive protein, all these things that we know are worse for cancer, or better for cancer, worse for us. Adipokines, people have heard about leptin, adiponectin. Leptin goes up with obesity, adiponectin goes down. And this whole concept of insulin resistance, having high sugars in your body, having high levels of glucose, altering the levels of insulin growth factor, IGF-1, and hyperinsulinemia also comes with obesity. And exercise has been shown in various studies in various cancers to act against almost every single one of those areas. It lowers your sugars. It improves your insulin sensitivity. It gives you a better adipokine levels. The leptins and adiponectins go in the right direction. It reduces systemic inflammation. And what's impressive, you do a quick, 30-minute moderate and vigorous activity, and the inflammation level changes you see are pretty dramatic. It reduces oxidative stress, something called AMP kinase, which is very important in anti-cancer. That goes up. This is really fascinating work. This was published just about 2 years ago. They took men, and they took half the men and they put them on a bike and had them go vigorously for about for an hour. And they took another group and had them just sit for that same hour. They drew blood from both of those groups. They then took cancer cell lines, these LNCAP cell lines, and they put those cell lines into the serum, the blood of these patients that exercised and didn't. And those that had exercised had a 30% reduction in the growth of those tumors in the dish. They then took some of those tumors and implanted them into mice. And they found that although the tumors developed in both of the mice, they developed slower in those that had that 1 hour of exercise. Something's going on in the blood, and it's probably one of these things. What we want to do is help understand what is that mechanism. How can we figure it out? Because then we can augment not only whatever we do for an intervention, but also potentially target that area as well. And so we're doing a couple of studies that we're leading and participating in here at the Hutch, the UW, and the SCCA. One of them is called PALS, the Prostate Active Lifestyle Study. This study is targeted toward men on active surveillance with our goal of trying to understand how obesity affects cancer progression, and also looking at other features, quality of life, et cetera. So the target population, we're looking for over 200 men on active surveillance. We're probably going to start enrolling patients early this summer, overweight, obese men on active surveillance. We're going to take them and randomize them to two groups. One will be just your general recommendations about diet and exercise, the goal getting up to 150 minutes a week of moderate to vigorous activity. And the other group we're going to have in the prevention center here, a 6-month intervention with a nutritionist and an exercise physiologist. And we're basing the intervention on what's called the Diabetes Prevention Program. It's actually very simple. It truly is just getting you to that basic exercise level and helping you how to eat smarter. And what's exciting is that patients can lose 7 to 10% of their body weight and keep this weight off for up to 10 years. 10-year data has shown that because this becomes part of your life. It's not a fad diet that you can do for 6 months and can't do it and can't keep doing it. We need to make a change for the rest of your life, and this type of intervention can do that. And then because men on active surveillance undergo surveillance biopsies, we'll be able to look at both their blood changes and also their tissue level changes as well. They're going to do questionnaires. We're going to have them, so we'll be able to look at quality of life, and we'll also look at changes in the cancer itself. And it's exciting. This is such a group effort, except for the radiation oncologist, Dr. Zhang, because we're not trying to treat these patients actively, but with surgery or radiation. Everybody else in this first group is a part of this study, a co-investigator on this study. And this just shows a schematic, randomizing patients to one of the two treatments. The other one that we're participating with, is funded by Movember. So Movember is the group that promotes growing mustaches during Movember to raise money for prostate cancer. If you didn't grow a mustache last year, start this year. They raised over $100 million worldwide for prostate cancer research. They have given money back. We are a part of several different Movember-funded initiatives. I know several in this front row have led studies with Movember. This we're going to look at exercise exercise in men with advanced prostate cancer, metastatic, progressing, castrate-resistant prostate cancer. The goal, we are one of, I think it's 15 or 20 international sites. There's only 4 or 5 U.S. sites, and we are one of those sites. The primary outcome is going to be looking at overall survival, because this is a more advanced state, but we'll also have other outcomes as well, looking at drawing serum. They're actually doing muscle biopsies in a couple of the patients to look at those kind of changes too. So very exciting. We're looking at both exercise in the early stage and also in the advanced stage. Active research going on here to understand this mechanism that we know exists and trying to define it. And I'll leave you again, 150 minutes, moderate to vigorous exercise a week, do some strength training. Thanks so much.
Thanks, Jonathan.